Before going to heart, you have to put correctly the pericardium. Okay. Then in between two fingers, thumb and index. This is the anatomical position of the heart. This is the viscera of the heart with pericardium, great vessels. Okay. Great vessels. Clear? So the apex of the heart is directed downwards, forwards, and to the left. At the left, fifth intercostal space. And base is, এভাবে হাত দিতে হবে, base. Base is directed upwards, backwards, and to the right. So right-handed direction. Clear? And sternocostal surface. It is facing forwards and upwards. Okay, clear? So this is all about the viscera of the heart. Now we remove the pericardium. So sternocostal surface, it is the apex border. This is the right border. একবারে আমি যেভাবে ধরতেছি এইভাবে ধরবা. You have to put the index finger along above to downwards. This is the right border. Clear? And from here to opening of the inferior vena cava to the apex, it is the inferior border. Only border always seen by one finger. Border is always seen by one finger. So it is the inferior border. From apex to the left auricle. This is the left border. And this surface is sternocostal surface. On the breast, this is the diaphragmatic surface. And this is the left surface. Clear? এরপরে আসো আমাদের parts or chamber of the heart. This is the right. You have to put all the fingers aggregated in single portion. This is the right atrium. Okay. This is the right atrium. This is the right ventricle. This is the left ventricle, and this is left atrium. Okay. Once again, this is the right atrium, right ventricle, left ventricle, and left atrium. Let us right atrium and left atrium কিভাবে চিনব? Right atrium there is two opening of the superior and inferior vena cava, and left atrium there is four opening for the four pulmonary veins. Okay, clear? This is the infundibulum. This portion is known as infundibulum. Infundibulum. This is the pulmonary trunk. Pulmonary trunk arises from the right ventricle. Pulmonary trunk arises from the right ventricle. This is the ascending aorta. দেখো আমি যেখানে forcepটা place করেছি, where I have placed the forceps. This portion is known as ascending aorta. Ascending aorta has two branches. One is right and left coronary arteries. Then above this forceps, this is the arch of aorta. This portion is known as arch of aorta. Arch of aorta has three branches. Okay. From right to left, brachiocephalic trunk, not artery. Brachiocephalic trunk. Then left common carotid artery. Left subclavian artery. দেখো এটা আমাদের brachiocephalic trunk হইছে, এটা left কেন বলছি তাই না? We added the left, but brachiocephalic trunk further divided into right common carotid and right subclavian artery. নয়ন তুমি একটু পিছিয়ে যাও, তাহলে সার্কেলটা একটু বড় হবে একটু। আমি কি আরো পিছিয়ে যাবো? ওকে, তাহলে দিস ইজ এরপর দেখো আমাদের চেম্বারগুলো পড়া হয়েছে তাই না? And great vessels, and this is the descending thoracic aorta. Okay, this portion is known as descending thoracic aorta. এরপর আসো, this is the anterior interventricular groove between two ventricles. Anterior interventricular grooves between two ventricles. This is the apex. Apex is only formed by the left ventricle. This is the posterior interventricular groove. Posterior interventricular groove. Clear? তাহলে আমরা, as you know, these are the interventricular groove. Interventricular are two types, anterior and posterior. Now the important thing is about the coronary sulcus. It starts from the right side. in the right auricle. This is the right auricle. It is the part of the right ventricle. Sorry, right atrium. So it starts from here. The আমি যেদিকে আমার পার্সেটা প্লেস করে নিয়ে যাব, ট্রেস করতে হবে. From here, here goes downwards, then goes downwards, then goes downwards. This is the crux of the heart. Crux of the heart, where the coronary sulcus and interventricular and interatrial groove are united. Okay. Then it coming backwards. This portion is the coronary sinus. So coronary sinus located behind the left ventricle. Okay. Between the left atria and left ventricle. The coronary sinus is placed in the coronary sulcus, left posterior coronary sulcus. তাহলে কি হবে দেখো, এখান থেকে ট্রেস করে নিয়ে গেলাম, দেন সামনের দিকে চলে আসবে। এখানে এসে কি করবা, এখানে অরিকলকে এসে এখানে থামবা। এখানে ইউ হ্যাভ টু সে এ ওয়ার্ড যে coronary sulcus, here coronary sulcus is overridden by the pulmonary trunk. Clear? তাহলে once again I trace the coronary sulcus from here to here, always seen by one finger. Here, this is the coronary sinus, and here it is overridden by the pulmonary trunk. This is all about the specimen of the external features of the heart. Okay, clear? And this is the pericardium. You see, pericardium has, as you know, that two layers. One is fibrous and serous layer. Serous has two types. One is parietal and another is visceral. On the outer side, there is a fiber-like structure that it is called fibrous pericardium. In the inner side, it's very glossy and shiny. This is the parietal layer of the serous pericardium. And on is the heart, this is the visceral pericardium. The another name of the visceral pericardium is epicardium. Okay. This is the cross section of the heart. What do you see in this heart? Okay. What did you see? You see the two chambers, right? One is the left, another one is right. You see the left chamber is almost oval shape and right chamber is triangular in shape. And between the wall of the left ventricle is thick than the right ventricle. How many times? 3 times. Okay. The wall of the left ventricle is thicker than right ventricle 3 times. Okay. This is the interventricular septum. Interventricular septum er artery supply korikore জিজ্ঞেস করে। Okay. It is supplied by the anterior and posterior interventricular branch of the both right and left coronary arteries. Okay, এতটুকু বলেন। আরো যদি কেউ ডিফারেন্সিয়েট করতে চাও, if you want to say more, be specific, anterior 1/3 is supplied by the anterior interventricular branch of the left coronary artery, and posterior 2/3 is supplied by the posterior interventricular branch of the right coronary arteries. Clear? এখানে দেখো একটা অরিফিস আছে। This is the atrioventricular orifice. Okay, atrioventricular orifice. All will be the same. These are the coronary arteries. Okay, this is the infundibulum, pulmonary trunk, ascending aorta. Okay, this is all about the heart. Now I comes to the lungs.